Hey y'all, it's Dr. Tiffany. I hope everyone's doing well. This is a viewer question from NanaGen2. With COVID, am I going to have a cough and just feel blah, or am I going to have all the symptoms is the question. Okay, so what we're going to do is we're going to talk about the most common symptoms of COVID these days, okay? They have changed a little bit since the beginning of the pandemic. At the beginning of the pandemic, shortness of breath and fever were in the majority of patients, 63% for shortness of breath, and I think like 72% for fever. Nowadays, the most common symptoms are headache, sneezing, runny nose, sore throat, and loss of smell. All of those had 60% or higher prevalence, except for the loss of smell. That one was a little bit lower. It's just very stereotypical COVID, but it seems to be increasing actually with the Delta variant. The most common total is runny nose. That's in 74% of people. What you do notice is that cough and fever are not on there. Cough is still very common. It's around 50 to 55% of people having it, but it's not the defining thing of COVID anymore. Actually, it seems to be the headache. The headache seems to be a very prominent complaint when people I see with COVID these days. A lot of times, if they're vaccinated, they'll describe the headache as a migraine or a sinus infection. They feel like they have a sinus infection. One of the ways this thing's been spreading is because a lot of PCPs just assume it's a sinus infection and treat accordingly. They never test. So we've been letting a lot of COVID slide that way. But originally, the original version, things like body aches, the fever, the cough, shortness of breath, they ranked much higher in the commonality of symptoms. So it has changed a bit. You don't get all the symptoms, and if you're vaccinated, you probably won't get but a couple of them. But if you get all the symptoms, you can't really predict who's going to have that happen to them, except for that they won't be vaccinated. That's the only common theme. Also falling a little bit has been GI symptoms like diarrhea. They used to be more common, and anecdotally I can attest to all of these things being less common in people that I've diagnosed. So you don't have to have any classic symptoms, and you don't have to have fever. Just remember that. It doesn't have to be a fever for it to be COVID. It doesn't have to have a cough for it to be COVID, okay? So when in doubt, get tested, okay? I love y'all. Please stay safe.